My name is Shannon Frattaroli. I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to today's Public Health Conversation. These conversations are meant as spaces where we come together to discuss the ideas that shape a healthier world. Through a process of discussion, debate, and the generative exchange of ideas, we aim to sharpen our approach to building such a world. Guided by our speakers, we work towards a deeper understanding of what matters most to the creation of healthy populations. Thank you to the many who make this event possible. In particular, thank you to our Dean's Office and our communications teams, without whose efforts these conversations would not take place. Today's event is part of our fall series, Fall 2024, called A Vote for Health. We have been welcoming speakers who are guiding our thoughts on issues of consequence for health and the upcoming US federal election. Today, we're going to discuss the intersection of the 2024 election and the work of violence prevention. We will engage with the causes and consequences of violence in society and discuss steps that can be taken to prevent violence in communities. I look forward to learning from our speakers as we discuss today's topic. I'm now pleased to introduce today's moderator. Nicholas St. Fleur is a general assignment reporter, associate editorial director of events, and host of Stats Health Equity podcast Color Code. He covers the intersection of race, medicine, and life sciences. Nicholas won the 2021 Everett Clark Seth Payne Award for Young Science Journalist and was a winner of the 2023 June Beadler Prize for Cancer Journalism. He came to Stat as a Knight Wallace reporting fellow in 2020. Before joining Stat, he was a freelance science reporter in the San Francisco Bay Area, covering archaeology, paleontology, space, and other curiosities of the cosmos. He previously worked for New York Times and The Atlantic. He has a BS in biology from Cornell University and is a graduate of the Science Communication Program at the University of California, Santa Cruz. Nick, thank you for joining us. Over to you.
Hey, thank you so much, Dean Galea. I'm really excited to be here. Thank you so much for your introduction. And it's my pleasure to be moderating today's discussion. As you know, this is A Vote for Health, Preventing Violence. Now, I have the privilege of introducing today's speakers. First, we'll hear from Apryl Alexander. Dr. Alexander is the Metrolina Distinguished Scholar in Health and Public Policy at UNC Charlotte. She also serves as director of the UNC Charlotte Violence Prevention Center. Dr. Alexander's research and clinical work focuses on violence and victimization, human sexuality, and trauma-informed and culturally informed practice. Then we'll turn to Ashley Brooks Russell. Dr. Brooks Russell is an associate professor at the Colorado School of Public Health and is the director of the Injury and Violence Prevention Center. Her research interests include adolescent health with a focus on preventing injury outcomes such as violence and suicide prevention, as well as the prevention of impaired driving. Third, we'll hear from Shannon Frattaroli. Dr. Frattaroli is the director of the Center for Injury Research and Policy and professor at the Johns Hopkins Bloomberg School of Public Health. Her research interests include understanding the role of policy in improving the health of populations, with particular attention to the implementation of public health policies and the role of advocacy and communities in the policy process. Current projects include addressing the opioid epidemic through innovative injury prevention approaches, understanding residential sprinkler policies as a strategy for preventing house fire death and injury, and maximizing the revolution in auto safety currently underway with the advances in automation and safe systems design. Last, certainly not least, we have Jeff R. Temple. Dr. Temple is a professor, licensed psychologist, and the Associate Dean for Clinical Research at the School of Behavioral Health Sciences at the University of Texas Health Science Center in Houston, where he also holds the Betty and Rose Pfefferbaum Chair in Child Mass Trauma and Resilience. As the founding director of the Center for Violence Prevention at the UT Medical Branch, his research focuses on the prevention of interpersonal and community violence, including firearm violence. As a reminder for our audience, following the individual presentations, we'll turn to a moderated group discussion. And one of the things I love to do is incorporate all of your questions into that discussion. So throughout the presentations, if you have any questions, please write them into Zoom's Q&A function, and I'll try my best to get it asked. Please don't wait until like the very last moment to put your questions in. If you have a good question, and sometimes the best questions come from you all in the audience, write it in as soon as it comes to your mind. That way I'll see it during our conversation, and I'll ask it to our great panelists here. So those questions, you'll be using Zoom's Q&A function, which is located in the bottom middle of your screen. Now to start things off, I'm going to turn over to Dr. Alexander. Dr. Alexander, you have the virtual stage.
Thank you so much, Nicholas. And thank you so much to Boston University School of Public Health for hosting this forum. It's just so important at this particular time as we approach the election to be having conversations about preventing violence. For me, I want to take the lens of taking a vote to end gender-based violence. My philosophy and the philosophy of my center is that violence is preventable. And so we want to talk about the ways in which we can advocate for ending gender-based violence. Not only is this important to me because of the work that I do, just want to center that it is Domestic Violence Awareness Month, that we know approximately 40% of women and 20% of men have faced some form of domestic violence in their lifetime. So not only is this an important time to think about bringing awareness to those stats, but awareness also has to shift to action. And that's what we're all here for today, is to really think about how we can take action to end domestic violence. I want to give some frame about gender-based violence. In recent years, we've been talking about the COVID-19 pandemic, but a lot of scholars and activists have talked about gender-based violence being a pandemic, given the pervasiveness of gender-based violence across the globe. When we're discussing gender-based violence, we're talking about violence that's directed towards an individual or group based off of their sex, gender identity, sexual characteristics, or orientation. We do think about the traditional kind of topics of violence related to physical abuse, sexual abuse, verbal abuse, emotional abuse, psychological. But gender-based violence also incorporates marital rape, discussions of sex trafficking, dowries, female gender mutilation, all forms that affect different groups based off of their gender or sex. And then I introduced ourselves to kind of thinking about the stats on domestic violence, but a book written by one of my colleagues, Dr. Anna Prince, talks about every 90 seconds. As you look at these stats right here, just reflecting on the frequency of gender-based violence, particularly in the United States. Recognizing that every 90 seconds, a woman is sexually assaulted. 1 in 5 women are sexually assaulted while on a college campus. So we know that violence is pervasive, and for a lot of us, really challenging ourselves to think about, how do we end this? There have been politicians lately who said, well, violence is just inevitable, and I don't believe that. We need to be thinking about the ways in which we can acknowledge these stats and then think about the consequences, which are lifelong. If we look at the CDC's conceptualization, as well as some federal work from the White House, we know that gender-based violence has long-lasting impacts on physical well-being and mental health. We know that gender-based violence can result in physical injuries such as traumatic brain injury, disability, and even sexual health problems. When we're talking about things like the maternal mortality crisis in the United States, gender-based violence is one of those precipitating events. When we look at things like chronic disease and how it impacts us and our well-being over the life course and early mortality, gender-based violence, again, is one of those factors. So if we're thinking about holistic health and well-being, gender-based violence is one of those things that we have to address. We've had a lot of conversations in the public discourse about this for years. We've talked about the Adverse Childhood Experiences Survey and how it has resulted in kind of getting us to think about the short-term and long consequences of those adverse childhood events. But we know that those adverse childhood events can also lead into adulthood and across the developmental trajectory. And so thinking about the impact that violence is having on our well-being. So how do we get to policy? If we know that this is a pervasive problem across the globe, we need to be thinking about policies that can help change the trajectory that we're seeing. So this year, we are recognizing that it's the 30th anniversary of the Violence Against Women Act. This act was initially created to provide funding to communities to address issues related to gender-based violence. This brought awareness about the backlog of rape kits, the need to have harsher prosecution for individuals who commit sexual violence, and even more importantly, brought a lot of community-based resources to victims and survivors of violence. So a lot of what came from VAWA is providing resources for physical health care, mental health care, providing resources to help survivors continue on in their lives and find a path to healing. With each iteration of VAWA, there has to be a reauthorization. So I went to the White House back in 2019 to talk about the need to reauthorize the Violence Against Women Act. Even though this act has had such big impact, there's still a long way to go. We have to ensure that these services remain intact to help victims and survivors. And for me, going to the White House to talk about the lens that we need to take in order to engage in prevention. If we're thinking about prevention and violence, we really need to start concentrating on factors that really help and aid in preventing violence. And we're going to be talking about that with each of our speakers today with different examples of violence prevention. Also, with the Violence Against Women Act, it has centered issues related to intersectionality and minoritized populations. So in recent years, we've gained a bigger awareness of the missing and murdered Indigenous women and persons movement, of really thinking about the frequency of Indigenous individuals who go missing or find murdered without any sort of justice, without searches being done for finding these individuals. We've also had a rise in hate crimes, particularly against LGBTQ individuals. And so making sure that our treatment services and all of our access to resources is centered from a culturally responsive lens that centers gender affirming care. And then lastly, earlier this week, just recognizing the Me Too movement and the impact that that has had, a movement that was led by Black and Brown women to bring awareness of their disproportionate rates of victimization across the life course. So when we're talking about the Violence Against Women Act, we want to also center those who are most marginalized in our communities and making sure that their voices get recognized in our efforts. We also have to bring about context to talking about gender-based violence, especially as we're approaching the election. We can't forget that COVID is still very pervasive, and when COVID-19 hit during 2020, having conversations about the impact of gender-based violence during that time where we had isolation, social isolation, had lockdown orders, and thinking about what that does to individuals and families. In some communities, we saw increased rates in domestic violence and child sexual abuse. And when I talked to legislators during that time, I said, we are going to need resources for the years to come. This can't be temporary funds. This can't be temporary resources during the height of the pandemic, but really thinking about the lingering effects of that. That in the context of the COVID-19 pandemic, domestic violence and other forms of gender-based violence were just different. And so me and my students being able to write about this and really kind of thinking about how can we, again, prevent the next iteration of this from happening during the next pandemic, and really thinking about how do we provide adequate resources to individuals. Also, as we're approaching the election, some of our issues that are at the forefront are going to intersect with each other. So during this election cycle, we're talking a lot about reproductive justice. Thinking about what the effects of the overturning of Roe v. Wade are. Again, in that article, when we were talking about COVID-19 and gender-based violence, we were talking about actions related to reproductive coercion. So individuals using manipulative tactics and coercive tactics in order to keep a partner or engage in further harm. When we're reducing things like reproductive access, this is further exacerbating the gender-based violence that we're already seeing in communities. So again, as we are looking from state to state and thinking about how they're implementing the overturning of Roe through the Dobbs decision, we really need to think about the impacts that that's going to have on gender-based violence. As people are seeking reproductive healthcare access, thinking about the risk that's taken for them, especially when we're criminalizing things like abortion right now. So for me in my career pathway, really getting us to talk about prevention. What are some of the things that work to end gender-based violence? I've been having these conversations in my career. Some of my work is around working with individuals who've committed illegal sexual behaviors and really thinking about when prevention should start. A lot of parents ask me, when should I start sex education with my child? And I said, as soon as that child starts talking, if not before. That we need to be thinking about things like developmentally appropriate sex education, which talks about bodily autonomy, boundaries, consent, and thinking about ways that that engages in violence prevention. And so being able to speak at the Colorado State Capitol on a bill that supported comprehensive sex ed that would do just that. Let's have healthy relationships training in our schools. Let's have developmentally appropriate sex education. Let's talk about consent. All of the things that we often see missing in our traditional sex education programs. If we are doing that, again, those are some of the precursors that can help end violence. So as we're approaching this election, last year, we saw this national plan to end gender-based violence that came out of the Biden administration. that, again, highlighted a lot of the things that the Violence Against Women Act has highlighted over recent years. Thinking about our investment in prevention, thinking about strategies for action, investment in community-based care and services, all of that was embedded in this plan. So as we go to the polls, actually, I was an early voter. I went day one of early voting here in North Carolina. So as we go to the polls, we need to be thinking about this and who we're voting into office. How are we holding people accountable for ending gender-based violence? So again, I want to thank you all for having me here today, and I hope you can join me on this mission to end gender-based violence. Thank you.
Dr. Alexander, that was incredible. Thank you so much for sharing. To the audience, if you have specific questions for Dr. Alexander, I would highly recommend you put it in the Q&A now so that we can be sure to address those during the moderated conversation. So up next, we have Dr. Brooks Russell. Dr. Brooks Russell, when you get the chance, please give us your presentation. We're super excited for it.
Great. And just let me know if anything's wrong with the screen sharing.
Everything looks great.
Great. Thanks also to Boston University for the invitation to be here today and for hosting this important conversation. Just 12 days away from the election. It's really an opportunity to reflect on the policies that we have in our political leadership, being partners in preventing violence with us in public health practice and public health research. Thank you to Dr. Alexander for her comments on gender-based violence. I want to zoom out a little bit to all the causes of violent deaths that we see in our country today. And we can think of these in three major categories: suicide, homicide, and unintentional fatalities. And homicide could further be categorized into multiple types: community violence, domestic violence or gender-based violence, mass shootings, and legal intervention involving law enforcement. And you can see here there's a varied context, risk factors, and settings for each of these. Some are quite public, like mass shootings and community violence, and other fatalities occur in homes and are relatively private. So just a range here. And although this figure depicts these categories as equal in size in terms of these circles, in fact, they're not equal in terms of their contributions to the deaths in the US. In the most recent data we see that suicide is the leading cause of violent deaths in our country, representing about 60% of all violent deaths. Homicide is an additional 30%. So together, those are 90% of the violent deaths in our country. And when we look at this another way, instead of the intent or the manner of death, but rather the actual cause, what we see here is firearms are the dominant mechanism. And this is why that it is essential and in fact unavoidable that we talk about firearms when we talk about violence prevention. They just have to be part of the conversation. No matter the intent or the setting, the firearms are just the dominant mechanism. And we know that, talking about firearms in this country can be politically contentious. This is just the reality. We find ourselves in public health. And interestingly, when I looked for ballot initiatives in this election cycle, it turns out that there aren't any state ballot initiatives that are specific to firearms this cycle. There were nearly a dozen citizen-led attempts across 7 states, but none of those actually ended up on the ballot this year. So while we look to elections and our policymakers to make progress in preventing violence, we can also look outside the legislative space and outside the political process and find common ground in our community by engaging with diverse perspectives and looking for community-based solutions. So what I'd like to share with you today is thoughts on taking a collaborative approach for violence prevention. And this collaborative approach requires values that I think we frequently have in public health: to understand personal beliefs, to have an openness to new information, new perspectives, and to innovation, to have some vulnerability to ask questions, and believe that we in our communities and as a society can find common ground and can share common goals and come together to prevent violence. And these are values that we've had here at the University of Colorado, at our Injury and Violence Prevention Center and the Firearm Injury Prevention Initiative, and it's really informed a lot of the work that's been going on here. And I just want to set the stage a little bit, here in Colorado, and this is probably similar across many states in the U.S., we have a firearms culture. When we asked adults in our state about their familiarity with firearms, we found that nearly half grew up in a household with firearms. 40%, more than 40% have firearms currently in their household, and nearly a third personally own that firearm or those firearms. And I think when you look at this and take in this statistic, maybe it's easier to understand why this is such a contentious issue in this country and so emotionally charged for people to talk about. When we asked adults in Colorado why they own firearms, these are some of the reasons that they endorsed. And what we see here is that protection really emerges as a dominant motivation: self-protection, family protection, property protection. And I think it's really helpful to understand what motivates firearm ownership, to have that conversation with people. And here is where I have some optimism that we can find that common ground, because in public health, we also value protection of individuals and families. So this can be really a starting point of conversation about where we share values and priorities in our communities. And I want to bring a message of kind of hope by talking about some of the successes we've had here in Colorado using this collaborative approach. Our colleagues, I can't take credit for this work, but many of our colleagues here at the University of Colorado, particularly in the Firearm Prevention Initiative, have been doing this work partnering with firearm owners, gun shops, shooting ranges, and firearm advocates and safety trainers to work on messaging that's shared across our communities that is grounded in a message of safety. So years ago, they formed a coalition, the Firearm Safety Coalition, which includes gun shop owners and trainers. And the goal is really around educating retailers or range employees and the general public about suicide prevention and firearm safety. And from these efforts came the Gun Shop Project, which I think other states have engaged in as well, which is about engaging with gun shops and retail locations and shooting ranges about promoting a message of temporarily limiting suicidal individuals' access to firearms as a really critical activity that we can engage in to promote safety and prevent suicide risk. And our outreach workers have attended gun shows across the state to engage in one-on-one conversations, to understand people's beliefs, understand their motivations, and find that common ground around safety, and in this case, preventing suicides. We've also been very lucky to partner with our state health department and the newly formed Office of Gun Violence Prevention to develop a lot of resources and make these publicly available to the general public, but also our policymakers in the state. And I think of this, I would describe us, when we think of the public health approach, we're really in these stages, these early stages of defining and monitoring the problem, identifying risk and protective factors. And we're in the early stages. I think the science is in the early stages of developing and testing strategies, but moving toward that now. So this resource bank in Colorado brings together external resources, overviews of firearm injury and death, a data dashboard, and enhanced surveillance. And I hope this is a model for other states to bring together these resources in one place. So just an example of what our data dashboard contains, there's many data sources that are all compiled in one place. Here's just an example of a slide from the Tableau dashboard on mass shootings and one on firearm sales in Colorado. And then we also make the surveillance data available, including a new surveillance system called the Colorado Firearm Injury Prevention Survey. And this is an example of what we can learn from enhanced surveillance, really being able to learn more about specific firearm behaviors. So here's just an example on storage practices. And then finally, we have a resource bank that looks at promising prevention approaches across the continuum of prevention. So all the way from upstream factors and out-of-home storage, means restriction, community violence interventions, the Gun Shop Project, hospital-based violence interventions. So just a range of prevention approaches that are being tested now, not only in Colorado, but across the country, and I think have a great promise for preventing firearm deaths in the state. And with that, I want to close by thanking and acknowledging my colleagues who have contributed to this work, particularly Dr. Emmy Betts and Dr. Erin Kelly. Thank you.
Dr. Brooks Russell, thank you so much. That was really fantastic as well. I really enjoyed all of the charts that you shared, and just everything that you were really drilling down there and explaining about the partnerships you had as well. Again, to the audience, if you have questions for Dr. Brooks Russell, put them in the chat now. That way we'll be sure to get to them during the moderated portion of this section. And Dr. Brooks Russell, I also wanted to point out that one of our viewers, Bakar Hussain, wrote in the chat, quoting you, "Progress can be made outside legislative space," and wrote, "Love that, very empowering." So that's so great to hear. So now we'll turn to Dr. Frattaroli. Dr. Frattaroli, please take the stage.
Thank you very much. And like everybody else, I just want to acknowledge Boston University and thank Dean Galea for inviting us here for this wonderful conversation. I also want to note that the work that I'm presenting here today is very much under the part of my portfolio that I collaborate with the Johns Hopkins Center for Gun Violence Solutions on. So I want to make sure that I acknowledge my colleagues in that center as I share some of the work that we're doing in that space. So again, thank you to Boston University. Thank you to all of you for joining us here this afternoon. If you're on the West Coast this morning, really appreciate the time you're taking out of your schedule to have this important conversation as we think about the election season that we're in, and as we think about public health and the importance of voting and elections and civic engagement to the work that we do, particularly in the context of violence prevention. So there are a lot of different ways that we can think about violence and how to prevent it. It's a complicated problem. And one of the great things about today's webinar is that you're hearing from a variety of different perspectives. And I just want to encourage the audience that this conversation is not about which strategy is better or which one, should we be choosing? This isn't an either or kind of conversation. We need all kinds of strategies, all kinds of interventions to address this problem of violence. And what you're going to be hearing today are a lot of different complementary approaches to reducing violence. When I think about what I can bring to the table for this conversation, my focus with you today is going to be on addressing access to lethal means, addressing access to firearms. And when I talk about firearms and strategies to address access to firearms in this country, oftentimes I'll get questions about, well, why the focus on firearms? And oftentimes my strategy focuses on laws as well. When we look at the data, when we look at how violence plays out in our country, be it homicide, be it suicide, firearms figure so prominently. And so again, for me, when I think about ways that I can contribute, thinking about access to firearms rises to the top of what I think is important to focus on. So majority of homicides, majority of suicides in this country are caused by firearms. So in terms of concrete strategies, one of the areas that I work in order to address access to lethal means is in the area of civil protection order laws. So that might be something that many of you in the audience are familiar with, others may not be familiar with, but let's talk a little bit about what civil protection orders are and how they relate to the problem of violence in the United States. So as the name suggests, a civil protection order is a civil court order. So it's not about criminal charges. It's not about arrest or putting people in jail or, they don't come with criminal charges that would establish one with a record. These are court orders that include due process protections and are really designed to be upstream interventions that offer people who are experiencing situations in which they're being threatened, situations in which they see a real, tangible risk of violence is sort of brewing, it's percolating. They can approach the court, they can ask the court for help before those dangerous behaviors escalate to more serious forms of violence. So it's a very prevention-oriented approach when we talk about civil protection orders. And civil protection orders, the two types that I'm going to talk a little bit about now, also include the temporary prohibition on firearm purchase and possession as part of what the courts can and do order. So the process of obtaining a civil protection order involves completing a petition with the court. It involves appearing before a judge and explaining why it is that you're concerned about how a particular person is behaving, how that relates to violent risk, and why you want the court to intervene. And if the court agrees, again, part of the protections that they can offer through this mechanism is to temporarily prohibit that respondent to the order from purchasing and possessing guns. The idea is that when someone's in crisis, when someone's recognized to be threatening violence or at risk of engaging in violent behavior, that it's probably not a good idea for them to have ready access to guns. So let's talk about some of the specific options that exist with regard to civil protection orders. I want to call your attention to the right-hand side of your screen for now. Domestic violence protection orders. I'm guessing that many in our audience have heard of these. These are, as the name suggests, a civil protection order that's available when people are experiencing partner violence, gender-based violence, at the hands of a loved one, of a partner, of someone they're dating, someone they're married to, someone they have a child with. And domestic violence protection orders currently exist in all 50 states. They have existed for decades. They are part of, the sort of core foundation of how we address partner violence in this country. Under federal law, respondents to domestic violence protection orders who have had the opportunity to participate in those hearings are, again, under federal law, prohibited from purchasing and possessing guns. In addition, more than half of states either replicate that federal language on gun prohibitions or build on it and add additional protections related to guns. When we look at evaluations of this gun prohibition aspect of domestic violence protection orders, what we see is statistically significant evidence that they're associated with reductions in intimate partner violence with homicide, with guns in particular, and intimate partner homicide generally. So good evidence that these make a difference when it comes to the most lethal form of partner violence when gun prohibitions are included. I want to call your attention now to the left-hand side of the screen and talk about a second type of civil protection order, the extreme risk protection order. These are also known as red flag laws, gun violence restraining orders, and extreme risk protection orders, or ERPOs, also a civil court order, are built on this domestic violence protection order framework, right? So we know that those gun prohibitions within domestic violence protection orders are effective. So ERPOs expand those protections to include, again, people who are experiencing partner violence, but also to include people who are experiencing or at risk of experiencing other types of violence. So interpersonal violence, community violence. If there is someone who is expressing suicidal ideation, extreme risk protection orders can be used to intervene and, again, temporarily remove any guns that are in their possession and temporarily prohibit them from purchasing guns. Extreme risk protection orders are also used when people are threatening mass shootings. So there's a variety of violence applications that we see with ERPOs. Again, and they build directly on that foundation that was laid by domestic violence protection orders. Now, unlike domestic violence protection orders, extreme risk protection orders are in place at the state level, and they currently exist in 21 states of the District of Columbia. So in case you're wondering if you're in a state where an ERPO law exists, The blue states noted on this map have ERPO laws, and most states in this country at this point have considered a bill that would put ERPO protections into place. So last count I did, there were 43 states and the district that had introduced an ERPO-style bill in the past 10 years. So what I want to encourage you to think about as part of this conversation, as part of this context in which we're thinking about voting, we're thinking about people who we elect to office and civic engagement, what are the opportunities, given that these laws exist, domestic violence protection orders in all states in the country and ERPOs in a growing number of states, what are the opportunities that we can maximize the impact of these laws through implementation strategies? So what I want to urge you to think about in the context of these civil protection orders are how can we focus not on the legislative aspect of them, but how can we make sure that they are being implemented and implemented in a way that's going to maximize their violence potential, prevention potential. And I've traveled across this country, been in a number of states where both laws are in place. And I can tell you from my own experience, as well as from the research that I've done, that uptake of extreme risk protection orders varies widely within and across states. I can tell you that when it comes to gun dispossession of domestic violence protection orders, we don't do enough to make sure that happens. So here are some screenshots of resources that we have available at the Center for Gun Violence Solutions on these topics. So I invite you to link with that QR code and check those out. And I also want to just encourage you to remember to vote this election season. I've got two new voters. Both my children will be voting in their first national election. And one of my favorite parenting moments was going to the primaries with them. So make sure you get out there and cast your vote and continue to engage in those processes of implementation to address violence in this country. Thank you very much. And Nicholas, back to you.
Wonderful. Thank you so much, Dr. Frattaroli. I really appreciate that presentation and hearing more about those laws and the legislation there. As a reminder to those of you viewing in, if you have questions for Dr. Frattaroli, for the rest of our panelists, please put them in the Q&A. I know there are a couple questions in the actual chat here. If you want to copy and paste those over to the Q&A, that way we'll get them asked. So next, we have our final presentation. Dr. Temple, take it away.
All right. Thank you so much, Nick. And I feel like since everyone else thanked everyone for being here, I have to as well, or else I'll look like a misanthrope. So thank you all for being here and for giving us your attention. I'll also say that I, too, have two new voters to the role. One who lives in Boston. So I considered, is this right, by the way, my view? Nick?
Yes.
All right, perfect. Look at that.
Great.
So my one who lives in Boston, and I considered telling folks at my institution that this was an in-person event so I could go see him, but I didn't know if I could get away with that. So anyway, here we are. So this is a picture of President Obama, the moment he learned about the Sandy Hook shooting, and that is relevant for my presentation for several reasons. We have a longitudinal study that began in 2010 with about 1,000 people. It's still happening. So they were recruited, these 1,000 kids were recruited when they were about 15 years old. We've been following them ever since. They're now about 30 years old. And we've been also surveying the current partners of participants as well. And in 2013, when this happened with Sandy Hook, President Obama loosened the restrictions on research. We had always been sort of allowed to do research on firearm violence. It's just that we couldn't advocate for things like gun control. And so to be really cautious, the federal funding pretty much dried up on anything that had to do with firearm violence. So there was a couple decade lull in anything related to firearm violence because although we could study it without money, it's pretty hard to do. So when President Obama loosened those restrictions, we began adding questions on firearms and firearm violence to our longitudinal study and began to really try to understand, really basic information that we have on every other form of public health problem. If you look at firearm violence and you look at the number of deaths that it caused per year, it's similar to things like prostate cancer and breast cancer. And if you look at the number of publications and the amount of funding that goes to those other very important public health issues, it dwarfs what goes to firearm violence still to this day. So we have a real basic primitive understanding of reasons for carriage, why someone uses, how they get their gun. And so we're really at the infancy stage of research with this. And on May 17th, 2018, I was giving a presentation to the Texas Senate on the importance of healthy relationship curriculum and school safety. And on the very next day, this was a school shooting that happened at Santa Fe High School, which is just about 10 miles from my city, Galveston, where I live, where I was also on the school board. So hit really close to home, knew several of the victims and the medical examiner who responded to it. Also, the shooter's mother worked about 100 yards from me at the university that I used to work for. So it really hit home there. And the scary thing I think about firearm violence is that if I were to poll everyone in this webinar, I'm guessing over half would have some close experience with a mass shooting, not just firearm violence, but a mass shooting. So knew someone, it was in a town where you grew up in, something like that. So it's becoming more frequent, more alarming, and scarier. After Santa Fe, Governor Abbott held a series of roundtables to address firearm violence. And to his credit, and I was if you can seek me out in the right top corner over there, and I was at one of these, and to his credit, he had folks from both parts of the aisle and really tried to focus in on solutions to the gun violence problem. This was not only after Santa Fe, but also Sutherland Springs, where there was the church shooting. So trying to get stuff done, trying to get solutions to the firearm violence problem out there. The problem is, as is the case in many states, but especially southern states, is right after this, despite some of the solutions related to mental health and everything else, it became easier to obtain a firearm and with no license or restrictions or anything. So anyone in Texas can carry without any license or anything openly. And you can see that this is probably not going to be a surprise to anyone in this talk, but if you look at firearm deaths, it is the #1 cause of death among children in the US. And if you look at our peer countries, it's not even mostly in the top 10. And if it is in the top 10, like if you look at Canada, where it's the 5th cause of death, it's still, quote unquote, only 48 kids are being killed per year versus over 4,000 in the US. And it's increasing. So if you look at our peer nations, they've all seen decreases in child firearm deaths, but in the US, it has been increasing. A little bit old data here, but unfortunately, with the COVID pandemic, we saw still increasing firearm-related deaths, including with children. So one thing that I really like to point out when we talk about firearm violence and we talk about violence in general is people understandably get nervous about sending their kids to school. But in reality, schools are exceptionally safe. In fact, schools are oftentimes the safest and most positive environment for many kids, right? So for those that are exposed to violence in the community or at home, schools offer a respite for them and somewhere that they can be fed and safe and happy and learn and socialize and all that. So I am careful not to have schools be the boogeyman in this instance. And the solution is not more police. I've given a similar talk to other crowds where the police were around, and I always felt weird about that. But it just is true that there's been plenty of research that shows that that the addition of police is not going to prevent school shootings or mass shootings. And in fact, it has a iatrogenic effect where what ends up happening is that Black and brown kids end up getting tickets and arrested for things that have nothing to do with school shootings. And in fact, school shooters are typically not Black and brown kids. Mental health is not the cause. This is another pet peeve of mine after every single any type of mass shootings you see that people are quick to blame mental health. And I was even, one of my tweets was put up in Time magazine, which I thought was pretty cool. But you can, it's frustrating on many levels because mental illness, there's not one mental illness that would suggest that someone would be a mass shooter. People with mental illness are way more likely to be victims than perpetrators. And even if you look at some of the mass shooters, that it was not mental health that was the cause. Some of them did have mental health problems, certainly not even half. But even those that did, it was other things like misogyny and xenophobia and racism and hostility and anger and things like that. So and even when you look at when you unpack it a little bit further, if you look at and some of the other speakers touched on this, domestic violence and family violence is overrepresented in mass shooters. And there was a study by Geller who found that I think it was about 55%, 60% of all mass shooters had a history of family violence. So, my thought there is, if we can prevent domestic violence, if we can prevent gender-based violence, then we would reduce not only everyday violence and intimate partner homicide with guns, but we would have an effect on reducing mass shootings. Lastly, and this is probably not going to be a surprise to anyone, but it's access to the guns that is the problem. That's, all of our peer countries, they have the same number of violent video games and violent movies. They have the same number of folks living with single moms and single parent households. They have the same number of bullies and loners and isolationism and incels and everything else. That's all similar across all of our peer countries. The difference is that we have unfettered access to guns, including long guns. But that being said, we live in reality, right? So we live, even if we were, and I'm not saying to do this, so if Fox News, if you're listening, don't put me on tonight. But even if we got rid of all the guns made it illegal to own a gun today, forevermore, we still have, I think it's 450 million guns in our country. It's going to take, again, even if we made something happen today, which we're not going to, and I'm not advocating for, but even if we did, it would take generations to rid ourselves of these guns. So we live in reality. This is the circumstance that we were dealt. So some of the things that we have been doing is some of the things that we need to do as a country is have active shooter drills. So I am on a committee to study the impact of these active shooter drills with the National Academy of Science, and we're putting together a report that will become available in the next year that will talk about what type of school shooting drills are effective, how to reduce the risk of unintended harms like psychological distress to kids and staff and so forth. The other thing is, and I love this quote, it's, we should not be looking for strategies to identify the next school shooter. We need to identify strategies, look for the kids who need help. Rather than identifying the needle in the haystack, our approach is universal primary prevention that affects the needle, but also the hay. That was said by me. That's why I love the quote. And I want to be honest, it's a really cool quote and it sounds really impressive, but I owe the journalist that because there's no way that I said it that articulately. But the point holds. We shouldn't be trying to identify the next school shooter. It's a waste of time and a waste of energy. Yeah, people often say, well, why don't they just get rid of that kid that is creepy or scary or draws pictures of guns? Well, if we did that, we'd probably, one, it would be stigmatizing folks and probably getting rid again of people that may not be the school shooter, but also you're talking about probably 10% of the school population, so millions and millions and millions of kids. So that is not a useful approach. So we need to focus on universal prevention. And that's one of the areas that we have focused on is this program called 4th R. So reading, writing, arithmetic, and the 4th R stands for relationships, where we actually teach kids how to be in a relationship. So how to apologize to someone, how to break up with someone, how to resolve conflicts in a nonviolent way. It takes over health class taught by coaches who'd rather be coaching. So it focuses on things like youth development and positive youth development. So not just stay away from bad stuff, but how to actually be healthy and happy. It's a universal focus. So every kid in a school or every kid in a grade gets it, which is nice because then you don't take quote unquote bad kids and put them with bad kids and everyone gets badder. Alternative schools are really dumb and they shouldn't be used. And then it's focuses on improving relationships and has a lot of role plays. It's dynamic, kids like it, and it works. So we found in a couple of different studies, we did a randomized control trial here in Houston with 24 schools, 12 control schools, 12 intervention schools, found that not only it predicted the first onset of violence, but those who had prior violence were less likely to re-perpetrate than the people who did not get the 4th R program. We also have a texting platform where it's very simple. Probably on its own, it wouldn't be too vastly effective, but as an augment to other programs, the kids can text this number, relationship to this number, and a few times a week or once a week, depending on what program we have, they get information about healthy relationships. What I like about it is it meets kids where they are, and as they pick up their phone and read the message, before they get pissed off that they've read the message, so they're getting that information. My favorite quote here is, if you're going to do anything for the common man, you have to start before he becomes a man. It's a little outdated and sexist, but you get the gist that we really need to start upstream if we want to prevent violence. And that means starting with kids when they're young. And as someone put in the chat, starting with parents. So really from womb to death, we need to talk about healthy relationship education. Thank you all very much. Thank you, Nick.
Doctor. Nope, I'm here. Dr. Temple, thank you so much for that. I super appreciate it. Someone put in the chat, Pavan Perswani wrote, "Thank you for naming this. As someone who does threat prevention at the university, connection between mental health and mass violence has been entirely misrepresented." So thank you for that, Dr. Temple. I'd like to ask all of the panelists to turn their cameras on, and it looks like I see all of your smiling faces here. Thank you all so much for your presentations. We're going to move on to the kind of moderated discussion portion of this webinar now. But again, I ask those of you who are watching at home, can you please put your questions in the Q&A so that we can make sure that they get asked? I want to get to as many of them as I can, and there's already a good chunk. So I want to make sure we can get those asked, because you all are so far asking some really brilliant questions, and this is a great opportunity for you all to, probe some of these really great minds in this field. So I guess to kind of get us started, all of these presentations were really incredible. I have jotted down a bunch of notes all over the place, but I'm going to start with Jeff, just because Jeff, you were or Dr. Temple, you were the most recent one on the screen. And I got to say, I loved when you shared that quote. And I love that you told us who was the genius behind the quote earlier. That was great. Your quote about, how do we find the kids who need help and how do we address that? And you talked a bit about it with the 4th R, but tell us more about that. Finding the kids who need help and addressing what they need help. You know how you said, we shouldn't be finding the next school shooter. We should be just finding the kids who need help. So let's start there. And if you could elaborate a little bit more about the work you're doing with the 4th R.
Yeah, so I will say that not only do we need to find the kids that need help, but we need to address every kid. And so, when I talk about this, and I get that that's a lofty, ambitious goal, but if we had the resources and we can start from the womb and to and through post high school, we could do some really impressive stuff with respect to preventing all forms of violence, including firearm violence. But the other part, by addressing all kids and doing it in a positive, strength-based approach, what I've talked about in that universal approach is the best case scenario is that we prevent the next school shooting. The worst case scenario is that we teach kids how to be in a healthy and happy relationship. So maybe we don't prevent a school shooting, but we're teaching these kids how to be healthy and happy. So it's not just about avoid alcohol, avoid violence, avoid sex, but how to be in a happy, healthy, sexually positive relationship and friendships and everything else. So it's really that universal focus that I think needs to be put in place. And I'll be real quick with this last point is if you look at the school shooting data, and apologize for focusing on that, but if you look at it, some of the kids were bullied, some weren't, some had two-parent households, some weren't, some were loners, some weren't, some were popular, some weren't, some got good grades, some didn't get good grades. So we just aren't really good at it. We can't identify them based on what we know. And so it's a losing cause to try to do that. And instead, we should be putting our resources in universal prevention.
Mm-hmm. Thank you, Dr. Temple. When I was watching Dr. Alexander's presentation, one thing that struck me, I do a lot of reporting on health equity, and I do a lot of reporting on the Black maternal mortality crisis. And you were talking a bit about that intersection between domestic or intimate partner violence and maternal mortality, but in particular the Black maternal mortality crisis. Could you speak a little bit more to that? Because that's something that has really struck me in my kind of reporting on this. When we talk about just maternal mortality, I don't think enough people realize the impact that domestic violence and intimate partner violence plays in that.
Yeah, and just seeing so many cases where we have the murder of pregnant women, right? And so anytime where we're looking at those cases, really trying to decipher what went wrong and what happened in some of these scenarios. Some of the work that my team is starting to do now is how do we do some early detection for domestic violence with individuals in healthcare systems? So can we ask about intimate partner violence for individuals who are coming into their gynecologist's office when they are visiting for their prenatal exams, and being able to provide them with the resources they need in order to thrive? What's so troubling about the maternal mortality crisis, particularly the Black maternal mortality crisis, is 90% of those cases are preventable. That when we do those postmortem analyses, some of it is ignoring women's pain, and we definitely know we ignore Black women's pain. Some of the things that might be precipitating violence, thinking about TBIs in domestic violence. So recognizing that a lot of individuals who've experienced domestic violence, we're doing some work on non-fatal strangulation, so have experienced choking, non-fatal strangulation beforehand, have experienced TBIs beforehand. So thinking about those who are most at risk and how violence intersects with violence. So we might see those incidents of domestic violence before it results in a fatality.
Thank you so much, and that brings me to Dr. Frattaroli. Dr. Alexander, you were talking about those signs beforehand, those warning signs, and Dr. Frattaroli, you were speaking a lot about the civil protection orders. First, could you, I guess, this is something that I'm actually not that familiar with myself, so I'm wondering if people watching, they might have more expertise in this area, but some folks may not even know too much about these. Tell us more about how people can, get more information about these civil protection orders, but also, what are the warning signs that should lead someone to be like, hey, you know what, I should really pay more attention to this, or I should seek out a civil protection order?
Yeah, thanks for that question. So I'll start with maybe your first question first, which is we have lots of resources on our erpo.org website. It was also the link that was on that QR code. in the slides that I shared. So if you scan that, you can go to that site for very detailed information about how those processes work. But shy of that, civil protection orders exist through our state and local court systems. So they are available through communities throughout this country. Again, those are domestic violence protection orders, extreme risk protection orders that expand on domestic violence protections to include people at risk of suicide, people involved with other types of interpersonal violence, and people who are making mass shooting threats are included under extreme risk protection orders. Those are available in the 21 states and District of Columbia where ERPOs exist. But what we're looking for with regard to whether or not someone would be a good candidate for a domestic violence restraining order or an extreme risk protection order is, are they behaving in ways that are dangerous? Again, to sort of emphasize what has been said before, what Dr. Temple is saying, mental illness is not a good predictor of violence, but behaving dangerously, threatening violence, acting in ways that suggest that violence is imminent are pretty much the best predictors of violence that we have. So these kinds of civil protective orders are available when those indicators of violence, when those dangerous behaviors are coming into play. You can go to court and engage with the court system to see if that is a strategy that can help move the issue forward in a way that can be resolved before violence continues to escalate and in some cases could become more lethal.
Great. I do want to bring Dr. Temple into this because he has his hand raised. But before I do that, you know, Dr. Alexander was saying earlier about the Black maternal mortality crisis, about, you know, how women, especially Black women, aren't believed, you know, when it comes to their own body, how they might be feeling, which could be dangerous to them, or, you know, in terms of just, you know, when women might go to the police and report intimate partner violence or domestic partner violence. And so, Dr. Frattaroli, I'm wondering, in terms of, you know, these restraining orders or these civil protection orders, what is the process like for someone trying to get this? Is it a lot of red tape for them? Are they able to navigate this? Are they being believed? I mean, you know, I'm someone who watches a decent amount of true crime, and so often we hear, you know, the victim went to the cops beforehand, and, you know, they tried to get these and they couldn't get them. They weren't believed. Tell us a little bit about how does someone who might be experiencing this navigate that red tape? How do they get believed?
Yeah, thank you so much for this question. I really appreciate your attention to the details because the details are so important here. This is what implementation is all about. There are support systems that exist. So there are wonderful advocacy organizations that exist to support women, others who are experiencing partner violence through this process, because you're right. There is misogyny, there is racism, there is a tendency to not believe when people say that they are experiencing partner violence in particular. The existence of advocacy organizations that can help people through those processes can make a big difference with regard to the willingness of people experiencing violence to engage in the systems and the ability to really be heard and to get the kind of response that they need. I talk about domestic violence protection orders. I talk about these civil protective orders a lot. And I can tell you that I hear all the time if I'm on a radio show or any kind of public forum of, you know, something along the lines of the storyline of the vengeful woman, right? This isn't really violence. She's just mad at him. He came home late. He, you know, sort of didn't get her the gift that she deserved. This willingness of some in our society to downplay the seriousness and the existence of partner violence is a problem that we have, but it's a problem that we're pushing back against. And again, it's an aspect of implementation that we can all be involved in addressing and really elevating the voices of people who come forward with experiences of partner violence to make sure they're heard and make sure they get the protections that exist in the system for them.
Thank you. And a quick comment that caught my eye here was Karen Woodall, who said, like, are there instances when a restraining order inflames the situation and there's more violence due to the filing of the order? What's your advice for someone who might be weighing those two options? Like, I worry for my safety, I should get a restraining order, but that's just going to make, the other person even more mad.
Well, one thing we know in the decades and centuries of experience with regard to violence against women, partner violence, is that the person who is in the best position to determine how to safely proceed with their relationship is the person who's experiencing that violence, which is why it's incredibly important, the point that you made before, to make sure that the people who are experiencing the violence, again, most oftentimes we're talking about women, are heard and are centered in this process. When we talk about domestic violence protection orders, it's the person experiencing the violence who is in the position to initiate those processes. So my thought, one of my responses to that is, if a woman is coming forward, if she has sort of mustered the courage and got herself into the courtroom where she's in a position to ask the court for help in a public forum, we need to listen to her, because what we've learned is that she is asking for help, and she is determined that that is what she needs at this point in time.
Thank you so much, Dr. Frattaroli. I want Dr. Temple, I want you to chime in, and then afterwards, Dr. Brooks Russell, I have a question for you. But go right ahead, Dr. Temple.
Mine will be quick. And since I brought it up about mental illness not being a good predictor of violence, it is a good predictor of suicide. And so we still should, from an extreme risk protection, our red flag laws still need to pay attention with respect to that.
Mm-hmm. Thank you for that. And, that melds well with what I want to ask Dr. Brooks Russell, which was, Dr. Brooks Russell, you spoke about how suicide was, the top form of violent death, which struck me because I never really put the two together. Yes, suicide is a very violent death, but for some reason, I just never really connected the two. Or do people kind of first do when you talk to people about it, do they make that connection? Do enough people really, when they think about gun violence, think about suicide? Or do they just think, if someone's going to kill themselves, they'll find a way, whether it's a gun or not? Is suicide, like, is that front of mind when people are thinking about gun violence, as it is one of the biggest, examples of gun violence that we have?
Yeah, it's such a great point. I think it is not the most salient thought in people's heads, which is surprising because of how many of us have been touched by suicide, thinking through our family histories, our extended families. It's not something that I think it's shared or talked about a lot. And if we did, I think we would find that many of us have been touched by suicide attempts or suicide in our families. And I think what it relates to is the privacy of it, occurring in homes, not occurring in public, not, getting splashed across the news. And this really relates to one of the comments about the focus on mass shootings, and those being a relatively small proportion, around 1% of firearm deaths. If you look at sort of the salience of people's mind in terms of the fear they hold that this could happen to them. And I think it relates to the fact that those are relatively, they're unpredictable, they seem without sense. And yet with suicide, I think we hold this perception that we could prevent it. And in fact, they are preventable. And yet, because they are, rather short-term sort of impulsive events, we don't do enough to prevent them. So I think there's a misperception in the public that there's a much greater fear of these infrequent but so-called random acts of violence compared to the day in, day out threat that lives in people's closets, frankly, for when a family member may be in crisis, that threat's there day in and day out.
Thank you for sharing that, because when I think about my own experience when it comes to gun violence, in the sense, I think about the death of a friend of mine in high school, Ralph, who did commit suicide using a firearm, and how that has really kind of painted my views on firearms in the home and such. And I'm struck by one of the graphs you shared with us, which was when you asked people in Colorado for their reasons for being a firearm owner, and the top one being self-protection at 70%, family protection, property protection, and you were talking a bit about how public health also values protection. So how do you communicate to someone who says they have their firearm for protection, but may also have, kids in the house and such, and how if their goal is protection, having a gun in the home just increases the likelihood for suicides and for these other accidents involved with firearms. How do you have that conversation? Or
Yeah. Well, yeah, I think we definitely, I think we have to start from a place of understanding why someone has a firearm and accepting that they do. And so it's about, what are their values? No one wants someone in their household to be hurt. And so that's, I think, the starting point for that conversation. And from there, I think we need to provide them ways that they can keep their household safe. So unless we have places that they could temporarily remove their firearm voluntarily, then we in public health can make those opportunities available to make it easier for people to do the thing that does keep their family safe when they need it. Maybe someone's visiting from out of town, or maybe there's a crisis that comes. What are they supposed to do with those firearms? We need to give them those solutions, and navigating kind of the legal implications. That's something that we can do for them.
Thank you, Dr. Brooks Russell. I want to turn to some audience questions in a second, but I'm also curious, this work is so important, but it can be deeply personal as well. As you've all shared, so many of us have had, whether it be interactions or have had instances where suicide has touched our lives related to gun violence, or mass shootings have touched our lives related to gun violence, or just, gun violence, whether it be, intimate partner violence, stories about that impacting our lives. Before I get to these audience questions, I'm wondering, are there any personal stories or anecdotes about why you do the work you do, what's really inspiring you and motivating you, whether it be a person you've helped, someone who's come to you for help, and because of these protective orders, you've been able to kind of make sure that they're safe, or someone who's dealt with gun violence and you're helping them through your programs or something. Are there any personal stories that come to mind that any of you want to share?
I'll go ahead and start. Mine looking at the intersection of domestic violence and firearms is we are doing a qualitative study. So we are interviewing women, and one of the things that one of the participants said was, he's never threatened me with his gun, or never threatened to shoot me or anything. But after we argue, after that, that's when he decides to clean his gun. And that sort of was like, okay, I get it, and the research bears that out. So a gun present in the household is related to more extreme forms and injurious forms of violence, even when the gun is not used.
Thank you. Any other anecdotes to share with the audience? Dr. Alexander, go right ahead.
Yeah, I think for me, just recognizing that violence impacts all of us. I think that's why all of us are here today, both the panelists and attendees. So for me, it was hearing about friends who were sexually assaulted during college. Then it was working at a domestic violence center in college and seeing the impact. It's being a Virginia Tech graduate who was on campus the day before the shooting. So we've seen these repeat incidents across our lifespans and wanting to do something different. So that's why myself and the people I work with, we have these personal and professional commitments to resolving these issues. And we bring all of these stories and what we see in our communities to our work.
Great. Okay, so I'm going to turn to some of these audience questions, and I realize we have a lot. We don't have much time left, but let's kind of get to some of these. Let's see. First, Elizabeth Ferrara asks, what needed roles can localized data people play in bringing awareness to violence and prevention efforts in their communities? That localized conversation seems to bring the greatest impact. So people who, do local data, Dr. Brooks at Russell, you go right ahead.
Yeah, I would love to talk about this. there are some variations in the data patterns across the country or within a state. And so for sure that's true. But by and large, I think that the trends are the same. And yet I don't think policymakers or decision makers are ever particularly satisfied by hearing about something nationally or even at the state level. They really want to know the impacts in their area. And so I agree. I think localized data can be incredibly impactful. And really it's the storytelling from that. I mean, the example that Jeff gave, hearing the story of an individual, it gives me chills, I know. And so I think that's where we get impact with people who need to be persuaded about this. So the more local, the more personal, I think the more impactful that conversation can be.
Thank you. Thank you. Dr. Frattaroli, we have a question in from the audience. Joan McGill asks, how successful are protection orders in preventing violence?
Yeah, so most of my work focuses on the most lethal forms of domestic violence. And when we look at protection orders at the state level that include prohibitions on the purchase and possession of guns, from a 30,000-foot population level, we do see statistically significant reductions in intimate partner homicide. So that's, from my perspective, some pretty powerful evidence. When we sort of look at less lethal outcomes, most of what we see in the literature is that protection orders result in reductions in reports of violence and reductions in the severity of violence when it does occur while those protection orders are in effect. So by and large, protection orders are looked at as a strong tool in the toolbox to address intimate partner violence when it is occurring.
Thank you so much. Dr. Alexander, we have a question here for you. They say, what do scholars in the GBV space say about how to navigate conversations around a popular presidential candidate who perpetuates GBV himself? What language is effective and approachable for developing a conversation around this and promoting a message that we don't or shouldn't tolerate that in our country's leaders? So this is a bit of a political question, but any thoughts there?
I don't know. We just had the statement that was released in the New York Times this week of all the victims and survivors of sexual assault by a presidential candidate. For us, again, we are all committed in this space to violence prevention, and we need to raise that. We need to make sure that we are holding people accountable for their actions. And I mean all people, regardless of your status, regardless of celebrity. Thinking about our work in violence prevention, it's about representation too. If we are not holding our leaders accountable, then what does that mean for us? So when we had the question earlier from the audience about why certain people don't report, marginalized people don't report, it's because of what we're showing in the broader landscape of things. Yeah.
Thank you. Thank you so much, Dr. Alexander. And, I was struck about something during your presentation as well while I have you. You were talking a bit about, it was I think it was like violence against Indigenous folks, which I feel is often left out in this conversation when we talk about gun violence and such. Could you talk a little bit more about that and why? Oh, it was the missing murdered Indigenous. Could you spend a moment just to talk a little bit more about that?
Yeah, again, there's been some increased attention towards this in recent years of really thinking, I think there's over 5,000 cases and reports of missing and murdered Indigenous persons, whether that's girls, women, or two-spirit individuals in the United States. When we look at cases of missing persons, what do we usually see in the media? Not women of color and definitely not Indigenous people. And there were some questions or comments in the chat that we didn't quite hit on some of our presentations. When we're talking about prevention of violence, we have to talk about broader systemic and historical issues. So we need to be thinking about and recognizing the intergenerational and historical and racialized harms in this country that have facilitated current violence. And that is the genocide of Indigenous tribes. That's the erasure of them. That's the land loss, the language loss that has impacted. And all of that is historical, but still current. So when we're talking about stolen land and looking at these missing and murdered Indigenous persons, it's often on land where we're still wiping people away. We're still blocking and having climate discussions and climate destruction of. So again, if we're having these conversations about violence, we need to have a conversation about history too. So again, this movement to address the issue of missing and murdered Indigenous women is going strong. There's states across the country who are creating task force to address the problem. So let's get some data. Let's have some accountability. So please locally look out for some of that work.
Dr. Alexander, thank you so much. Dr. Temple, you wanted to add?
Yeah, thank you, Nick. And I'm really glad Dr. Alexander brought up some of the structural factors, because things like the fourth R, an individual approach, are great, or even extreme risk protection orders are great. But really, if we look at some of the structural determinants and historical determinants of health, if we can address those, then we can prevent violence as well. So childcare is prevention. Affordable housing is violence prevention. Livable wages is violence prevention. So all those sort of things, that if we can focus on those from the 5,000-foot level, I think there's less use for people like us.
Mm-hmm. Thank you for that. Dr. Temple, while I have you, a question here that I think might relate to your work. They say, this attendee says, I struggle with the focus on mass shooting, given that they make up 1% of firearm-related deaths. And then they go on to say a similar argument could hold when it comes to interpersonal firearm-related deaths. How do we balance the salience of our country, wide fear of mass shootings, with the scope of that problem on an absolute scale?
Yeah, it's an excellent question and thought. The reason mass shootings scare us so much is because we can't other it as much as we can things like domestic violence and gang violence and accidental shootings and things like that. We with those, we can say, oh, that won't happen to me. I'm in a healthy relationship, or I'm not in a gang, or I'm trained with firearm. I'm not going to accidentally shoot myself or someone else, or I'm not going to die by suicide because I'm fine right now. So with mass shootings, it's very easy to say, oh, wait, I can actually be a victim of that. So that's why it's really scary. And I'll say that, I think that as terrible as they are and has as low frequency as they are, it does bring needed attention to firearm violence, including gang violence and domestic violence and everyday other forms of violence, that if that's what it takes to get us talking about it at the political stages, then so be it.
Mm-hmm. Thank you, Dr. Temple. A question here for Dr. Brooks Russell from another attendee. They say, could buying guns, aka gun ownership, be a means for people to find belonging? So is there rationale that people are more motivated to purchase guns to fit in with a group or those around them?
It's an interesting idea. I don't know if I have seen that in the literature necessarily, but what it makes me think of is some of the populations in our country who are more likely to have firearms by nature of their occupation. So thinking about law enforcement or military or veteran communities. And so I don't know if it's quite the kind of the direction of relationships in the question, but certainly those might be particularly vulnerable populations because of their because of firearms kind of being just part of their world. And some populations probably need extra attention because they're more vulnerable.
Mm-hmm. Thank you for that. Can we also speak to, this is kind of more of a general question for the audience, for the panelists here, but when we talk about gun violence or firearm violence, what about the impact on people's kind of mental health when it comes to seeing videos of people who have been the victims of gun violence? I think of particularly, Black men who may have been the victims of gun violence at the hands of police officers. Could we speak a little bit to the impact of seeing all of that in a hyper social medialized world? Dr. Alexander, you want to go right ahead?
Yeah, I think we're bringing bigger attention to vicarious or secondary trauma from witnessing acts of violence. We started talking about this more post-September 11th, when people saw the footage over and over again. People were exhibiting symptoms of acute stress disorder and post-traumatic stress disorder, and they weren't even close to the areas that happened on that day. And same goes for police shootings. I actually did a talk with Jeff, I think shortly after the death of George Floyd. And with him and other reporters, they asked me, what were your first reactions when you watched the video? And I was like, I haven't watched it. We have a bunch of research that says that that is a form of racialized trauma, that watching those videos does exacerbate mental health symptoms. So even the presence of observing these different types of violence, whether it's the school shooting, the police violence, et cetera, that does have an impact, not just on direct victims and families, but everyone.
And Dr. Alexander, while I have you, I have another audience question here, and then I'll kind of get to the wrap up. But they asked that you mentioned the Biden administration had a gender-based violence plan. Are you aware if either of the two main candidates have similar plans and or support the continuation of the Biden plan?
Because that plan, it was enacted by the current administration, I don't know if there's any plans for continuation of it. Vice President Kamala Harris is cited in the plan. So I hope that the commitments in that plan would continue on, but nobody has directly cited that plan in the debates or anything so far.
Thank you, Dr. Alexander. So as we wrap up here, I'd love if each of the panelists could just kind of leave our audience with a take-home message or a call to action as we talk about gun violence as this public health problem, emergency, really. What do you hope the audience just takes away from this conversation here? And Dr. Frattaroli, I'd love to begin with you.
Sure, thank you. I guess my parting comment would be that violence is not something that we need to live with. One of my greatest concerns about our society right now is that there seems to be an acceptance of all forms of violence, and this is not the way we have to live. And the people on this panel are a small slice of the larger community that's working very hard against that notion. There are strategies that can come into play that we can realize that will bring us to a better world. And I want the panel to walk away feeling that tomorrow is going to be a better day and violence doesn't have to exist in our society in the way that it currently does.
Dr. Brooks Russell?
Yeah, I guess my closing thought would be that we shouldn't be afraid to have conversations with our neighbors about our values of promoting public health, and that we can find ways to have those conversations that diffuse the political tension, because we do share common ground. And I just hope people feel comfortable sort of getting rid of some of the taboo about having those conversations, because that's how we're going to change stigma and norms.
Dr. Alexander?
I think we all showed great appreciation for Dr. Brooks Russell's quote earlier about progress. Each and every one of us is here for a reason. You showed up today, you took time out of your day to show up to have this conversation. Let's think about what you can do in your venue to address violence. Each of us has different skill sets. Each of us has different comfort levels. Is it you going to a school board meeting and raising questions about prevention programming? Is it you going to a city council meeting and learning about the budget and saying, yep, we're not committing enough to the sources that can contribute to reducing violence? Or will you become an elected official one day and change law and policy? So I am hoping we take away that there are multiple ways at getting at this issue. So let's raise awareness and then think about how you want to individually engage in action.
Thank you. And Dr. Temple?
Prevention is not politically expedient. So politicians want immediate results, and prevention doesn't fit into that. So just to echo what everyone else said, let's be proponents of prevention and prevention science and make them care.
Thank you, Dr. Temple. I just want to give a special thank you again to everyone on this panel, Dr. Temple, Dr. Brooks Russell, Dr. Alexander, Dr. Frattaroli. Thank you so much for sharing your insight with all of us. I think this was a very meaningful conversation. And with that, I'll pass it over to Galeo. Go right ahead, Mr. Galeo.
Thank you. First of all, I would like to thank Nick Sinclair for expert moderation. It was really a masterclass in moderation. And I would like to echo thank you to Drs. Temple, Brooks, Russell, Frattaroli, and Alexander. I thought it was a really, really excellent conversation. Perhaps the last thing Dr. Temple said captured a lot of the sentiments in my mind, which is prevention is not politically expedient. But of course, it highlights how important it is that we actually do the work that we do to elevate the work of prevention. I have found these conversations, and this one perhaps in particular, highly illuminating as we head into an election season. And I think it captured very well the challenges ahead of the country that should inform really how we think about the upcoming election and what we do afterwards. So to all our speakers, Thank you. Thank you for what you do. Thank you to our audience for being engaged, and thank you to everybody who does this work. Everybody have a good afternoon, evening, and in the coming weeks. Take good care.
Bye, everyone.